and welcome to Hadassah On Call, New Frontiers in Medicine. I'm your host, Maayan Hoffman. Summer is finally here. The weather is hot and the kids are finishing school. This is usually my favorite time of year, a time to think about heading to the beach, getting a suntan, and enjoying a more relaxed pace. I'm glad it's summer, but as the war continues in Israel, I admit things feel a bit heavy. We've picked out camps for the kids, and I'm planning a trip to Wales to see Billy Joel in about 6 weeks. Life goes on, even as it feels sometimes like it has come to a complete halt. This week, we're kicking off our summer podcasts and celebrating men's health with a focus on gastroenterology. This field covers everything from the esophagus and stomach to the small intestine, colon, rectum, pancreas, gallbladder, bile ducts, and liver. Did you know that the stomach isn't the only part of our digestive system? Here are some interesting facts about digestion. It takes 2 to 4 hours for the stomach to digest food before passing it to the small intestine, though this can vary based on what you eat. Carbohydrates and proteins are processed relatively quickly, while fats take longer. You can actually live without a stomach. Your digestive system can still function without it. And your emotions? Yep, they can impact your stomach and the rest of your GI tract too. Research shows that stress and anxiety can contribute to conditions like irritable bowel syndrome and GERD. To talk about this and answer all of our questions about gastro diseases, including colon cancer, we have with us today senior gastroenterologist Dr. David Hakimian, who specializes in clinical nutrition and bowel diseases at Hadassah Medical Organization. Welcome, Dr. Hakimian.
Thank you. Thank you for inviting me.
So gastroenterologists deal with so many areas that impact our gut health. Our bowel movements, however, are a small part of it and maybe just a very small part of it, but still very important. So I want to actually jump right in with a question that I think our general listener would want to know, which is your poop, right, can be a first indication that something is seriously wrong. So tell me about that and what do we look for? How do you explain it?
Okay, so that's a great question. And actually, yes, poop is a good indicator that things might be going not so well and might even go bad. And first of all, the first question, when we ask our patients is, do you have any change in your bowel movements? It's very, for us as a gastroenterologist, we like to know if our patient has usually constipation and whether now he has, let's say, diarrhea, or whether even the texture of the poop is changing. So maybe the first question would be is about bowel habits. So, for example, patients that used to have 1 to 2 bowel movements a day suddenly have constipation. Yes, we want to know about it. The second thing is regarding the poop itself. So yes, it might show that things are going bad, and we would like to know as a GIs when you're coming to our clinic, and we would like to ask you questions such as, whether there is bleeding, blood, fresh blood, meaning that the stool is mixed with red blood, and whether there is a different change in the color of the stool. Is it black? Is it green? Is it white? And maybe for the more, it's rare, but we also see sometimes that, poop is not flushing very well in the toilet and the person needs to flush it a few times. Sometimes it might indicate some issues with the pancreas.
Oh, wow.
And as I mentioned before, those changes might show that there's serious, situation, even cancer.
Wow, amazing that one would see that through poop. It's very interesting that you would see that, in just somebody's bowel movement. Now, I'm assuming that poop also changes over time as you age. So are there normal changes that take place that one shouldn't be worried about and say, oh, it's just aging poop? I mean, what is that?
Well, there might be some changes, and but that's the thing. Sometimes the changes might be within the normal change. Let's say, and you had for a few days diarrhea, and then it's back to normal, and you saw some change in the color of the stool, but then it came back to your usual state. However, when it continues and you don't really understand, you don't really understand what's going on, so you should refer to your treating, physician or primary care physician or even the GI. If you're in a follow-up or something, just report on those stuff. Because, for us as a gastroenterologist who, that's part of our job to deal with poop. What for the patient seems normal thing, for us it might, indicate a serious situation.
It's a dirty job, but somebody, I guess,
Yeah,
has to do it.
it's a dirty job, but we are. My kids, they ask me, "Oh, you're not a real doctor. You deal all the time with poop." So yeah, we're dealing with poop, and part of our job is know everything about the poop. Yeah.
Amazing. So I want to jump away from the poop and actually talk
Okay.
about some of the other disorders as well
Okay.
that you deal with.
Yeah.
And I'm wondering, how you approach treatment plans. Like, if do you, for people that have issues like IBS or Crohn's disease, when you see these kind of patients come in, do you personalize them? Does everybody get the same plan?
Yeah.
What does it look like?
Well, the world and the medical world and in the pharmacological world is going to a direction of personalized medicine. Meaning, in simple words, that we're not giving the same treatment for each patient. First of all, we need to know the history of the patient. We need to know his medical history. We need to know his current medication that he's on. And we need to, of course, understand his clinical course of, what's exactly going on with the disease. Then we need to understand with the patient what he expects. He or she needs, each patient have different expectations from the treatment. And with that knowledge and with, of course, the physical examination and the lab work, and again with some labs that we're doing even to the poop, we try to understand what kind of treatment the patient needs. um, Again, in one of the things that we're dealing with more today and than we used to do in the past, and understand another field in GI that is evolving very rapidly, is the field of the microbiome, which we try to personalize the medications or personalize even the treatment with understanding the microbiome of the patient. It's still in the very early stages, although there's a lot of literature about it. But definitely that would be one of the directions in the future regarding personalized medicine.
And just to tell our listeners, the microbiome is like the in the gut, right? It's the bacteria in the guts.
Yeah, the microbiome, you can say that most of our weight, even of our stool, is practically germs and microbes. And for years, there was understanding that even in China, many years ago, they used to, do like a stool transfer between people. And now, 3,000 years after, we still dealing with that. We're doing that in very severe cases of infection of the bowel. And but still, there's a lot of knowledge ahead of us that we don't really understand.
Fascinating. Now, I know one of the other things that you work with is colon cancer. And colon cancer was always considered an illness for older people.
Yeah.
But in recent years or decades, it's really started to get younger and younger. And I know in the United States that we saw a 5-year shift that went from
True.
50 to 45.
Yeah.
So what do you think the reason is for this? And are we seeing the same thing in Israel?
So we just spoke about it. I moved back to Israel after 2 years in Chicago.
Ah, okay. Midwest.
And-
I'm from Kansas. So,
Okay.
very good.
So I worked there at the University of Chicago, and yes, definitely we saw a shift over there, especially in some of the populations over there in Chicago, that cancer is seen, colon cancer is seen in early ages. And the past, again, you're right, it was disease that we saw in older person, but now we see it in young people. And one of the theories, or there's a few theories of that, and first of all, at least in the United States, at the Midwest, we see more obesity. And colon cancer, although you think that it's unrelated, we know that colon cancer is seen more with obese people The other thing that might go with that is that the United States, people don't use over there the Mediterranean diet, but that's a Western diet, and especially in maybe rural areas or in the Midwest, people are eating something between 60 to 70% of ultra processed food. And again, that's one of the reasons that we see that shift in those years, that people eat less fibers, people eating not healthy food, people are smoking, and probably those one of the reasons that we see those changes now.
And so you're not seeing it as much in Israel where we do try to follow better diet?
I think that we see also more young patients with colon cancer. We do see that change, we do see that shifting, but not as seen in the United States.
Interesting. I'm sure with the way that our diets are changing here, we're not that far off.
Yeah, we're not far away from that.
Yeah.
Yes, definitely. And probably might be also that our screening age will be different maybe in the next few years.
Amazing. So now, how important is it to use precision medicine in your field when it comes to things like targeted drugs or even immunotherapies to directly attack colon cancer cells instead of, let's say, chemotherapy, like we're seeing with some other cancers?
So again, we know the toxic effects of chemotherapy on a patient's life. And the chemotherapy is, let's say, is hitting the cancer with a bomb, compared to more of those newer treatments that we see today, and those biologic treatments that are more common now than used to be in the past, which have a way to affect the tumor, the cancer, in a more precise way, such as like a targeted missile hitting only the target itself and not destroying the healthy parts of our body. So yes, we're seeing that, and that depends on many things. You can say that mostly it depends on the cancer itself, what kind of cancer. And there's a lot of genes and some molecular biology testing that being pathological testing being done here and and Hadassah and in some other places, to understand exactly what kind of treatment will be the best for this specific type of cancer. And of course, you put to the equation the age of the patient, his medical history, and kind of like at the end with this equation, the oncologist, is deciding on the best treatment for the patients.
Sure. Now, you mentioned diet being very impactful on colon cancer specifically, but I am assuming the diet is actually very impactful on gut health in general and gastro issues. Can you talk a little bit about that diet and lifestyle, and what can people do to try to prevent getting to the stage of not even cancer, but just being sick, and not feeling well?
Well, nutrition in GI health and or GI diseases is a very hot topic these days. And the people sometimes are coming to the clinic with the same question: okay, what can I eat to feel better? What can I eat to improve my bloating, improve my abdominal pain? And there's I can say that there is not one answer fits all.
Yeah.
And that's a very common, and that's a very common question with a very long answer and difficult one. I can say that the one thing I do recommend to my patients, and I used to do that also, in Chicago, and also in when I was in the States, is eat fresh food, eat healthy food. Do not eat processed food. And just to make the difference between processed food and ultra processed food, sometimes I tell my patients, if you don't know what are the ingredients, you look at something, you look at the Oreo cookie, you don't have a clue how this Oreo cookie was made and from what are the ingredients in Oreo cookie, right?
Right.
Okay, that's an ultra processed food.
Okay.
Okay.
Mhm.
And when you look at the chips, right, you see that, oh, that's a potato, right? So that's a processed. So eat more healthy food, eat more fresh food, and don't use the whatever, sometimes you need to work more to get the healthy. So I guess one answer doesn't fit all of my patients, but this definitely is just eat more healthy, and that will prevent many GI diseases and some other states of unrelated to GI diseases such as tiredness, anemia, and other things like that.
Sure. I'm sure there's a difference between men and women, like when you give this advice, who's more
Yeah,
apt to follow it.
definitely.
Do you find that it's harder for men to talk about their GI health with you
Well,
versus women, or not so much?
So again, you you can say first of all, women are definitely more community. They have, it's more easy for them to speak about their health issues than men. Um, but sometimes, when it comes to poop and it's come to bloating and it's come to some things that are not really comfortable to speak, I definitely see a change toward the man. And, they have no difficulty speaking of, whatever they have over there at the toilet, their gas issues and some other stuff. They speak fluently about that without any problem. So usually, the tendency is easier for women, but maybe in GI, sometimes it's easier for the men. Yeah.
Are there any common misconceptions about digestive health that you encounter? And when you do encounter them, how do you address them with the patients?
So many patients, at least in the things of nutrition and with GI and everything. So one of the things that I see all the time is, oh yeah, I have allergy. I cannot eat that. And bread makes me bloating. I don't eat bread. And the other things make me also abdominal pain. And I don't eat that. I have celiac disease. I don't have celiac disease. And people are dealing a lot with what makes them feel bad. And I cannot eat that because it makes me feel bad and I have pain. And yes, we don't have a lot of good lab for that. We don't have good examinations and reliable examinations for those allergies, at least for now. But definitely, before stopping eating this and that, and that causing me diarrhea, and I don't eat meat or I don't eat that, so you should speak with with a dietitian. You speak with a gastroenterologist about those stuff, and not force yourself to not eating or avoiding some food that you need. That you need the vitamins, you need the minerals, and you stop eating that food because you think that it's unhealthy for you, or you think that you have celiac but you never checked it.
So like
Celiac disease, of course, is a disease, just to to tell our audience that celiac disease is a gluten sensitivity, which is gluten is part of almost all of the most of our carbohydrates that you eat, bread, pizza, pasta, or whatever.
just so that bottom line, is just don't Google and seek professional help
Well,
before you
yeah,
just
that's
start making decisions with your
definitely
diet.
that definitely, especially when it comes also to things that you avoid for many years, and then you find out, oh yeah, I don't have celiac disease. Oh, why did I stop eating bread for like 3 years or
Yeah.
something like that?
Yeah. Is there any new research that you're working on? Any advancements in the field that you want to share?
So I'm working with one of the researchers at the Hebrew University, named Moran Yasur. She's a very talented microbiome researcher, and she was a few years at the States at the Broad Institute, and she's dealing mostly with the pediatric population, with infants. And the thing that we check, we are thinking, and there's some evidence for that, not in this research, but that inflammatory bowel disease, which is, as you know, Crohn's disease and ulcerative colitis, might transfer to the baby, but not only by genetics and by environmental things, but also through the microbiome of the mother to the infant. Meaning that what we do is we check again the poop.
Always comes back to
Always come back to the poop. We check the poop of the mothers with inflammatory bowel disease and without inflammatory bowel disease during labor, and then we check the infants poop for for during their hospitalization after labor, right? and then after we check that for another few weeks, and we want to see by analyzing the microbiome to see if there's any um, if there are any resemblance between the mothers which have the inflammatory bowel disease to the baby itself. And maybe changing in the future the microbiome in a way before giving, before the labor, maybe doing a C-section, or doing like doing or not, and not doing natural delivery, might change the outcomes, you know of the of passing through the inflammatory bowel disease.
Be interesting to see that research when it's done.
There might be a few years for that, but
Okay. Well, we'll be around. So hopefully we'll do another podcast. We'll talk about it when you have the
sure,
results.
why not?
So I just want to end on a personal note, asking you what inspired you to become a gastroenterologist.
Yeah. That's an interesting question. I think I was exposed to that. I think that when you exposed the medical students to different fields in medicine, I thought, oh yeah, maybe maybe want to be urologist, or
It's not
surgeon.
that different.
Well, yeah, you can see, you can say that, but or even, I thought about being, even when I was after that, we go to GI, to gastroenterology from internal medicine. So, I had other options. I thought about other things, but I loved and still love this field, because not only that you can diagnose your patients, and you can think about it, there's a puzzle and a mystery to understand what your patient have. You can also treat it. You can also treat it with your hands by doing, endoscopy or colonoscopy and some other things like that. And you can also have like like a long-term follow-up on your patients. It's not like, okay, I'm doing a procedure and bye-bye, but you can also see them, and there's a good connection between your patient. And GI, you know, have this, they have the procedure field, and also the follow-up. So yeah, that's what attracted me at that time. And still, I mean, I love what I do. I love all of those things. So yeah.
Wonderful. Well, thank you, Dr. Hakimian, for
No
being
problem,
here.
no problem. Sure. Thank you for inviting me.